So stripping, that's what we talk about, how we're gonna be seeing that we have a problem if you're not stripping. This is one of very simple, cows that come to the parlor, you have to see if they have abnormal milk or not. So by stripping, you see, I do not like stripping on the floor. If you have a Staph aureus positive, for example, that will be in the floor, and this could be passing, it's a contagious pathogen, so I don't like this. If it's possible, use the container. CMT, how many of you are doing CMT? It does kind of, when you do, like for high somatic cell, heifers, fresh, and you do kind of same, yeah. It's something that we are not using that much, and it could be a tool for us to be using more. I like it. Why we do pre-dip? This is kind of basic, like everybody knows that what we do pre-dip to reduce the number of bacteria that we have in the surface, right? So that's the idea of doing pre-dip. You do pre-dip, you reduce that number of bacteria that you have, and here you will see, like if you do not do anything and if you pre-dip with iodine, the number of bacteria there are, it's much lower that you harvest for that one teat skin. It's much lower. So it really is an effective way and an easy way of reducing that number of bacteria. And why the number of bacteria is important here, because when you bring those cows to the parlor, they are already stimulated, and the teat end, it will be opening. If you have a lot of bacteria on the skin, you have a lot of bacteria in the skin, that bacteria can get into the gland. And it's what Dr. Enger brilliantly showed on that figure, like you do have to have bacteria for them to get into the gland and cause mastitis, right? So if you reduce the potential number of bacteria, you kind of reduce your probability of having those inside the gland. At the milk parlor, one thing that is really, really important, and it could be a risk factor for causing mastitis, is the way that we align, for example, and to remove, the way that we manage that unit. So cows come in, they should be clean. I always say, like, I do not like water in the parlor, because if you are using water in the parlor, there's something wrong before, right? Like you have to bring those cows clean. So no water. And like the cleaning should be easy, and then you pre-dip, dry, and then you attach the unit. When you are attaching the unit, something that sometimes we do not pay much attention, it should be like this. We don't want to be things like this. This should be painful, right? And it's not right. Put a lot of pressure in different vacuum, and this will hurt the teat end of those cows. And the teat end, and I think I do have some slides here, is just, like, it could be like the two other, you can see the teat end as a two ways. One will be the teat entrance, the entrance for bacteria on that, for that cow. Or you can see that the teat end is really a door for that bacteria to get in, right? If it's closed, bacteria won't get in. If it's open, they will get in. When it's closed, all the cows, when comes, they will have that plug. Or even after milking, you will form that plug. Usually, why we ask the cows to be eating after the parlor? Why we do ask them, like, to be standing and eating? Huh?
So they don't lay down right away.
Yeah, and get the bacteria in. So it's the time for that plug to be formed and close the teat end. So then the bacteria won't get in, right? You decrease your possibilities of having mastitis. I deviate a little bit, but it's... So unit, when you have your units attached, this should be very important in terms of the alignment, removal, and the time that unit is attached as well. We don't want to over milk that cow, because over milking, depending, you should have, like, this is all considering that your vacuum is correct, that your pulsators are working fine, that everything is working fine. Even that, if everything is working fine, if you let that unit suck much more than should be on the gland, it will cause overmilking and increase damage to the teeth and damage and increase your infections rates for mastitis. And then the last, we do pulse dip. So we do have milk. When you remove the unit, your teeth will be covered with milk. Usually we do have some bacteria around there. Milk is good for us, milk is good for bacteria as well. She will be multiplying, the teeth end will be open at that time. If you have a multiplication of those bacteria and they will get in, you have mastitis. So that's why we ask them to be standing, to be eating, so we have the time to this to be closed, and then you decrease the chances of that bacteria to get in. So then when we do post dip, we replace this milk with a teeth germicide, and then you will be killing bacteria, decrease the number of bacteria. This is the ideal, right? Like this is the clean, healthy teeth, but we can have something like that. So if you have some problems with your milking machine, for example, you will have like kind of blue, red, and you have those rings. So this will be just telling you that something is wrong with my machine, and I have to address that, because this will be something that it could be like a risk factor for me to have mastitis. What do you guys think about cleaning that first, or even cleaning this one and cleaning this one in the parlor? This one is much harder, and if you imagine how many bacteria do we have here compared to this one, right? So this is another risk factor for having mastitis. If you have something like that, increase your chances of having bacteria, increases your chances of having mastitis. So when we go to the parlor, what I do, like we do a score, and there's 1, 2, 3, or 4, based, and you guys have that in your handouts, and we're going to be talking briefly about that. But your equipments, for example, you know, like we have done everything, and then you miss those type of things, or even this type of things that nothing. But you know, it doesn't look like good. So this is before and after. So as I said, like mastitis is kind of like the detail problem, detail disease, because everything is good, and because you have something like that, it could cause you some problems. So everything that you are doing in terms of nutrition, in terms of bedding and work and everything, you miss those type of things, and it could be just a trigger to have an increased number of somatic cells.